Okay, we're going to play Life and Death 2, subtitled The Brain. And it is the sequel to another game called Life and Death. Now, in this game, you play as a neurosurgeon. You're going to be diagnosing and curing ailments of the brain. So we can sign in here. We are Dr. Sphincter. This is the hospital. And it looks like we have a patient in room 1. Now, usually you start by going into the classroom here. And you can learn all sorts of things here about neurosurgery and diagnosing neurological problems. So we can leave this guy, and let's go check out our patient in room 1. Oh, she does not look happy. Let's take a closer look. So, yes, we are Dr. Sphincter, and here we go. This is our patient's eyes, and here are our tools. We have this spoony thing, and we have this neuralizer looking thing, and a sign that says "Say Alice," and then a pin of some sort. So let's have her say Alice. She says Alice, as you can hear, perfectly. So let's check her eyesight. How are her eyes working? Not very well, it seems. Not very well at all. But actually, I think they're actually working the way they're supposed to. They just, yeah. So you see, they're a little off actually. This one looks like it's a little, I don't know, looks like it's a little off. But maybe it's just always like that. So let's try testing the pupil dilation. They are already dilated and they will not go back down. So let's check out the chart. Abnormal dilation in the left and right eyes. No light reaction in the left and right eyes. Slurred speech? No. So here's what we do. Start by reading her chart. Patient is a 47-year-old woman, admitted semi-conscious. According to friends, she was non-responsive to their presence. Allergic to crab and other shellfish. So that's a note if you're going to take her out on a date afterwards. No crab. And here we can prescribe whatever we'd like to do. And put our initials. And you can check your neurological textbook, which is just full of helpful information that I am really not going to read through. But if you look closely, you can see that it says cocaine. So let's see what's up with that. Patients overdosed with cocaine will show dilated pupils, but few, if any, additional abnormalities. CAT scan, MRI, angiography, and skull x-rays are all normal. Well, we don't know quite enough yet. So if she has a problem with her brain, she's going to have a problem with her motor skills and her feeling of touch. So let's poke her a little. Oog. Oog. Ouch. Oog. So that means she has feeling in both of her arms. So that's good. I don't actually think this does anything right now. So that does nothing. Let's look at her feet. Can she feel her feet? Ouch. Oog. And she has reflex in the right and reflex in the left. So that's actually good for her. So what was that we read about cocaine addiction again? Normal dilation and light reaction. Let's try poking her in the face. Yep, she can feel that. Hmm. I think we need to check off reflex. Oh, there you go. Reflex there. And reflex there. Alright. So, maybe we will diagnose her with cocaine addiction. We give it the doctor's sphincter seal of approval. Let's see. This, yeah, well, we are definitely looking at something here. You know, they don't really teach this stuff in medical school. Let's try a CAT scan. Code red in the CAT scanner. Quite an allergic reaction, I must say. I thought hay fever was bad. What? Was somebody eating crabs in the CAT scanner? That's what she's allergic to, crabs. Your patient died in the CAT scanner due to an allergic reaction to the contrast dye. We'll talk about this in med school. Report there immediately. Alright, well, apparently, as we just learned, the CAT scan dye is made from shellfish. And so I guess that means I just killed my patient. I cured her of her cocaine addiction. So that's good. But, yeah. Well, why don't we try again? We wouldn't be a very good doctor if we weren't willing to try again on another unsuspecting patient. So, we have to go back to class because apparently we don't know how to doctor. So, classroom is here. Before examining the patient, you should read the patient's history. This will often provide you with clues as to the patient's condition and warn you of possible pitfalls in the examination and treatment process. He is very serious about this examination process. Like, patients could die or something. I did read the chart, I just didn't know. Please report to class immediately. Some patients are allergic to iodine, which is used in the contrast dye for the CAT scanner. You should not order CAT scans for such patients. Huh. So apparently, allergic reaction to shellfish and other seafood is a good indicator that a patient has such an allergy. Well, now we know. Let's try another patient. She doesn't look very confident in our abilities here. Let's check out her eyes. Very beautiful, womanly eyes here. Let's have her say Alice. Alice. Speech is fine. Let's check the ocular motor skills. Whoop. Whoop. Well, apparently they work just fine. More or less, as well as we can hope. Let's check pupil dilation. Oop. Yep, they definitely dilated. Let's try face pain. Ooh, there's no face pain. Ooh, there's no face pain on one side. That's important. So, no pain on the left side of the face. Let's check the legs. Or, well, we'll check the arms. Women like to be romanced and wooed before you get to the good stuff. Alright, that one works, and that one works. Let's try the pain. Oog. Nothing here. Sounds like a problem. I'm not sure how to test the weakness. How do you test the weakness? Well, I don't know how you test the weakness, but it's okay. Let's check the reflexes. Yes. Yes. Oog. And no pain on the left side. So let's see. Reflex absent, aggravated, and no pain on the left side. It's still open to cocaine addiction. Let's see what the chart says. Patient is a 27-year-old woman brought to the emergency room unable to use left hand. According to paramedics, they found her on the floor, unable to move. Let's start with an MRI scan. Dr. Sphincter approved. Looks fairly normal, I guess, in my thoroughly professional opinion. Let's see what else we can do. How about an x-ray this time? RS. Stand back. Looks looks like she's wearing some sort of helmet. So it's a good thing she wore a helmet. CAT scan. Wait, I think we already did this, didn't we? Yeah? That actually looks okay. How about an angiogram? Hmm. I guess that's normal. Everything's okay with the angio stuff. Huh. The brain. The angiogram. Aneurysms. Abnormal dilations of the blood vessels in the brain. They gradually enlarge until finally they rupture and bleed into the brain. The resultant bleeding causes severe headache or unconsciousness. Weakness of the arms and legs can be present, usually on the opposite side. Abnormal pupil dilation, light reaction, and eye movement occur on the opposite side. CAT scan and MRI will pick up the aneurysm unless the bleeding is small. Angiogram will show the dilated blood vessel. Skull x-rays are usually normal. Well, I don't think it's hysteria. She's not just crazy. Not just a headache. Is it a subdural hematoma? Collection of blood clots in the subdural space between the brain and the dura mater. Anyway, if the hematoma is on the left side, speech will be slurred. CAT scans and MRIs will show an abnormal blood clot. No. Lack of sensation in one of the patient's limbs, depending on the nerves affected. Peripheral neuropathy. But just one of them. Brain tumors usually grow quite gradually. The tumor will appear on the CAT scan or MRI scan. Well, we didn't see anything in the scans. Being a doctor is hard. Maybe it's an infarction. If the infarction is on the left side, speech will be slurred. CAT scans and MRI will show a damaged area in the brain. Angiography often reveals the occlusion. Geez, hmm. 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 Commonly occurs in women. I guess women can get quite hysterical at times. Let's see. Well, we're probably going to take a guess here. Let's just check out. Let's check one of these out real quick. Really make sure. I mean, there's nothing. There's nothing there. Hmm. Well, okay. So we have hematoma. Hmm. Hmm. How about an infarction? Jeez, I really don't know. How about a brain tumor? Tumor will appear on a CAT scan or MRI scan. No, right? We said no. Neuropathy, MRI, or X-rays are all normal. Weakness or lack of sensation in one of the patient's limbs. So let's go with peripheral neuropathy. In our expert opinion. Oh no. Hmm. Let's see. How about we prescribe physical therapy? She developed schizophrenia and had to be committed. So she went crazy. We were such a bad doctor that she went absolutely insane. So, we're 2 for 2 right now. Dr. Sphincter, please report to class immediately. Let's learn what we did wrong. You should always perform a full physical examination of the patient before specifying a treatment, so that you have all of the information and avoid a misdiagnosis. Before examining the patient, you should read the patient's history. Hysteria often causes weakness and loss of sensation on one side of the body. All other diagnostic tests all other diagnostic tests will reveal normal conditions for hysteria patients. The best course of treatment is drugs. Lots of drugs. Class is over. See you next time. Dr. Finker, you have a patient in room 1. Oh, she's back. Ooh. uh, okay. Let's check the motor skills. They're working. Yes. And the light. The light. And the speech. Say Alice. Alice. Okay, and now let's test the pain. Ouch. Oog. Oog. And let's see. Everything's normal there. So let's check her arm. Oh yeah, fist bump. Okay. Now let's check the pain. Oog. Oog. Okay, and now to check her legs. Nice gams. Everything's fine there. And poker. Oog. Ouch. Oog. And everything seems normal. Since she did show up at the hospital, however, let's get something to bill her for. Patient is 47 years old, admitted unable to use the left hand. According to family, they found her on the floor, unable to move. Recently received a pacemaker, so let's check out as a pacemaker. Let's check out the angiogram. Everything kind of looks normal. But an MRI. Code red in the MRI scanner. Ah, the old pacemaker in the MRI machine trick. Bet the doc doesn't try that one again. Okay, well, we killed another one. And but at least you get to have pizza. So you always have to look on the bright side of life. Your patient died of pacemaker failure in the MRI machine. Report to class on the double. Severe punishment in this hospital here. Let's find out what we did wrong. Read the history, and yes, the MRI made the pacemaker explode, and that's about it. Let's try one more time. This guy, this guy does not have any faith in us whatsoever. Let's take a look at him. You know what? Let's be a good doctor and read the thing first. Patient is a 22-year-old man who came to the hospital with a severe headache. According to friends, he was non-responsive to their presence. So severe headache, and he was unresponsive. Let's take an X-ray. Looks okay to me. And the old MRI scan looks okay to me. I hope these machines work because they were very expensive. We had to fight to get them. And that looks a little weird somehow. It's all like weirdly shaped, but I guess we can't fault him for that. Angiogram. Once again, modern science has done nothing. Okay, well, let's go check him out. In the face. Pain first. Oog. Nothing on that side. See, at least. Boom. Yes, there's definitely a problem here. Let's check out his wonky eyes. Wonky eyes actually work. And let's check out the pupil dilation. Yep. And so, no pain on the right side. And slurred speech. Don't forget the. Let's see here. Now the arms. He has reflex on both. But I bet he does not have pain on the right side. Oop, no pain. Yes, no pain on the right side again. Okay. I guarantee he's gonna have no pain. One more time. Oog. Yes, so you can, I don't know, you figured this out, but it checks it off as you do it, so you do have to do it. So let's see. What else can we do? Probably not much. Not much. I guess we can diagnose. So everything looked normal. Maybe this one is peripheral neuropathy. See, because the other one was hysteria. I get it. A sensory defect may also be present. So that was one thing that was apparently present. So neuropathy. Let's go with neuropathy again. Yeah, I think you have peripheral neuropathy. I don't know what to do about that. Hmm. So, so maybe. Hold on. Hold on. He was non-responsive. Maybe this guy is a cocaine addict. Yeah. Hmm. Yeah. Peripheral neuropathy requires a treatment of physical therapy. Upon recovering from a migraine headache, your patient decided to see you for malpractice. Guess he's feeling better. Perhaps you need to spend some time in med school. Yes, that would probably help. So, he had a migraine, and that's why he couldn't feel anything. Let's find out why. Yes, a full examination and the patient's history. Migraine headaches can show many of the same symptoms as more serious conditions. Weakness and aggravated reflexes, as well as speech slurring, can occur in a migraine patient. Uh, Best way to distinguish this situation is performing a CAT or MRI scan, which should reveal no abnormalities for migraine patients. But that's what I did, and yeah, there were no abnormalities from what I saw. I think I'm just a really awful doctor. That's what it is. I'm just a terrible, terrible doctor. And that's pretty much life and death right there. So maybe we could just try to operate real quick. Yes. Okay. Now let's see one more one more patient here. He does not look happy either. Okay. Yep. Mm-hmm. Oog. Yeah, nothing there. Yes, both counts. Nothing there, and ouch here. Okay. Mm-hmm. Oog. He's 60. He couldn't use his right hand, and they found him on the floor, unable to move. Looks normal. Looks fine. Looks fine, I guess. And I guess, so far I haven't seen anything out of the ordinary on any of these. Maybe I'm reading them wrong, but yeah. Well, he's 60, so we should probably operate a hematoma. He's not here. Oh, because they're ready for us in the OR, which is here. No, this is the radiology lab. Operating room is here. Yeah, it's fine. I should be a good surgeon if I can't find the operating room. It was the one I didn't click. Nope, not that one. Yeah, lost in my own hospital here, don't mind me. Oh, here we go, I found it. Yeah, here we are at the operating table. The patient has been prepped for surgery, even though I believe he was a guy before, but that's okay. And it's mostly just an oversight from the designers. We have a variety of tools here. Let's start with the scalpel. Scalpel. Electrocauterizer, used to cauterize bleeders. Fish hooks, anchors the scalp away from the skull. Irrigator, used to lubricate and prevent heat buildup. Trephine drill, used to drill the burr holes in the skull. Yes, the burr holes. Suction, used to remove the subdural hematoma. Rainy clip, place the scalp flap as it is incised. Let's cut. Oops. Well, I guess were you auditioning for the next slasher film? Get to class before I call the police, you quack. Yeah, get to class. Let's find out what we did wrong, and then I think we're done playing this game. Surgery is not like slicing bologna. When you take the scalpel and slice into a patient, you're taking a life into your hands. Be careful. Oops. You should always perform the full examination history, and it's over. And I think it's over for all of us in this game. Yes, I am leaving. And there you go. It's just a game for fun, not education. Nothing that appears in or on the package, manual, or the software program is in any way intended to be a statement or representation of fact. So they really didn't want you to think that you were like training to become a doctor with this game. Because, this is how I would want to do it. Really playing a low quality game like this. That's pretty much exactly how I would want to do that. But anyway, that is Life and Death to the Brain.